So I had obviously seen my um, normal doctor. I remember one time I had a appointment with her and I like described a symptom and she just wrote me a prescription that I didn't even know why. Like what? And I started reading the side effects for this stuff and I'm like, it was like I had heartburn and she like wrote me something. I'm like, this is not what I want. So I was looking for something a little more personal than that.
And I think people today, more than ever, don't see the results with conventional healthcare. One size fits all.
My doctor, when I went to the doctor, he put me on some kind of pills, which I don't want the side effects. And I just say no to the drugs. I don't have time. When you're working 12 to 14 hours, you don't really have much time to do anything. So that's always my goal, is to come here. She understands where I'm coming from, and she's trying to help me, and and we've been on a good path ever since. And now I never got weighed again, but I think I lost some pounds. I noticed a lot of people notice I lost some pounds, but it's going to be a long road. But that's the road I'm going to take, because I don't want to be on drugs.
When we speak to our patients, we speak about folks being generally coming to us when they're starting to have signs, symptoms, and disability. Our focus at Victress is to try and get people way on the other end of this spectrum to where they're living their best lives, because we want you to live well as long as you're alive.
So many times you go to a medical doctor and it's this pill, this lab work, and never really getting to the etiology of the problem. So I think for them it was very refreshing.
Well, if you have a child that has, constipation, or, a diarrhea every once in a while type thing, or, things like that are going on. It's something you need to be aware of, and it's something you need to be talking with your provider about. Not so that they'll say, oh, well, here's some Miralax, it's pretty safe. It's not that. It's like, what is happening? Why is this happening? What is underlying that?
I have struggled for a long time with things that are just not right. And I've been to so many healthcare places and been told over and over again that they don't know. Like there isn't an answer, or there isn't anything wrong, and I just need to basically buckle up. Because I was looking for something different, something that mattered, or that would look at me as a whole person. And that's definitely what I found here, because it isn't just like, hey, what is happening on the surface? But there's been so many times where it's like, okay, this is what's happening on the surface, and here's how we're gonna deal with that, but let's look at what's underneath, let's look at what's really going on, and fix the bottom line. And that has made a huge difference in so many ways.
Even more interesting is that there's such things now that we know of certain strains of probiotic that specifically become almost as effective, and as effective sometimes, as antidepressants.
I'm not worried about them responding to me within the next hour, and most of the time she's responding to me in the next 15 minutes of just directions or something. So having somebody that you can ask a question when it comes up and not have to wait to, if it happens on a Friday night, which it always seems to happen, or a Saturday when nothing's open, you can message Danielle and the team, and within a short amount of time, they're responding and giving you a direction. And that right there has been a huge blessing with a kid, especially with my oldest, with his asthma and just different things like that. Just making sure we've got him, going correctly in the right direction. And Rose with her anxiety, it's just been a blessing to have somebody to be able for them to talk to, but also that takes the time to listen.
I didn't know if it was more just because I'm a mom of twins, or is there something more to it? And I just felt like I always got, here's a medicine, or you're just a mom. That's just, So I was interested in actually getting blood work done and actually seeing, was there something more to it than just being a mom or just another medication.
I can call anytime. I can ask what feels like a dumb question. I have someone to support me no matter what my issue is, physical health, mental health, any of it. And so that helps motivate me and keep me going, that I'm okay, and I can get up and do it again.
The environment is very welcoming, it's very peaceful, and just knowing that being able to come into a place where you don't feel like it's a doctor's office, that you can come in and just be, at peace, and knowing that everybody is open and welcoming, and that just makes it, instead of you're just feeling like that cold. Most doctors' offices, it feels cold because, you know, no one's really talking to you until it's your turn.
Because I want to be able to provide our employees and our team with an actual benefit that was useful. And I found, like, my experience at Victress was, I recommend it to everybody that asks me anything. And so I really wanted to be able to provide that experience and that resource for our team members.
But really he was fully on board, like we're not leaving this after the first few appointments. When he saw the changes, or I would come home like sometimes in tears and sometimes with happiness, you know, good tears, like they're actually gonna help me. And then he was fully on board with that. And now he comes, so that's been good for him as well. He's jumped on, and he's had the same level of care that I have, and really feels the difference as well.
And I guarantee you, unless you are either asking your doctor about it or diabetic, you're not getting all of these first three. What's fascinating is fasting glucose is the last thing to show us that our blood sugars are out of whack, okay? First, fasting insulin changes, then A1C changes, then fasting glucose changes. So why in the world would insurance only pay for fasting glucose in the normal population? But guess what? That's where we're at, and that's why you need to ask for these things. So
Once you start looking at the numbers and the benefits and what you get out of it, I feel like it turns into like a no-brainer at that point. Oh man, yeah. I have been, like, I can't thank Victress, Danielle, Tracy enough. Like, for personal things, I have simple things that, especially with Tracy, I've been working on for 8 years, and we've done very simple things, and I actually have not run in 8 years, and this week have taken steps in running and have not felt pain for the first time since 2015. So
don't give up. I mean, if you feel in your core that something is the cause, there is a cause somewhere. And there are people like your team here who care enough to dig deep and find that issue. And so I just encourage anybody who feels like that to keep pushing, keep asking the questions, and don't give up, and find you guys. Come here.